So Florida's First Lady had been battling breast cancer, you may remember, since late last year. October, in fact, is when we all heard. Dr. Dianne Johnson, the director of breast imaging for HCA Florida Memorial Hospital, is joining us live via Zoom this morning. Good morning. Thanks for being with us.
Good morning, Jen. Thank you for having me.
So this is certainly encouraging news for Casey DeSantis, certainly a friend of the morning show and a former colleague here on the morning show. What happens now for her and others who undergo treatment and surgery and then their doctors ultimately announce that they are officially cancer-free?
Right. So cancer-free really means that there's no evidence of disease, meaning the doctors can't feel any tumors, we can't detect any tumors on imaging studies, and that means that the patient is going to enter the phase of breast cancer care called survivorship. And survivorship really has many goals. So we want to reduce the risk of recurrence, obviously. We want to have early detection of any problems that may arise, whether that's a recurrence, a new cancer, or some other health problem. We want to optimize the patient's health because we know that these days with the great treatments we have for cancer, many cancer survivors actually don't succumb to the cancer. They die of the same thing. All of us in the United States die of heart disease, diabetes, stroke, dementia, things like that.
So what are the chances of the cancer returning in the same area or perhaps another part of the body?
So there's always a possibility, and the risk of recurrence really depends on so many factors. It's hard to give a blanket statement, but each person can talk to their doctor about their risk. But just know that regardless of what that risk is, there are so many things that we can do to prevent recurrence. So often patients will be prescribed a hormone pill that can reduce recurrence depending on the type of breast cancer, but also lifestyle modifications. So simple things like incorporating more fruits, vegetables, whole grains into the diet, being more physically active, maintaining a normal weight. The American Institute for Cancer Research has 10 recommendations that are fantastic for all of us, but especially important for cancer survivors. You can find those at aicr.org. And then also, it's so important, obviously for everyone, but really for cancer survivors, to keep getting those screening tests that are recommended. So mammography, sometimes in cancer patients will incorporate MRI. Some cancer patients will need other things like CT scan, bone scan, PET scan, things like that. So you can talk to your doctor about the specifics to your individual case, but whatever those recommendations are, cancer survivors really need to make sure they follow those recommendations so that we can ensure the best outcomes.
And obviously every milestone is fantastic, and this is a wonderful one for Casey and her family. Is there one in particular, though, the 1 year mark, maybe the 5 year mark, that could really signal that this could be maybe over for good?
You know, I'm hesitant to give a specific day or time. We like to think in terms of 5 years or, 10 years, but really the longer the better. Yeah. And, don't ever sort of let your guard down. I mean, you want to be relaxed and enjoy your life, but it's important for all of us to make sure we optimize our health as much as possible so that we can, prevent any problems from recurring. And then if those problems do occur, that we can jump on them very quickly and take care of anything that comes up.
And briefly, Casey, we know, was diagnosed at the age of 41, young, that's rare. But given that, the key, as you have already touched on, is early detection. Your message to women about catching breast cancer early and the best way to do that?
Yeah, so for average risk women, we want annual screening mammography beginning at age 40. So that's a mammogram every year. If you're at an elevated risk, and you can find out about that if you come to a dedicated breast center like the Memorial Breast Center, or you can talk to your doctor to do a risk estimation. If you're at a high risk for breast cancer, you may need to start screening early, and you may need to incorporate things like MRI.
Dr. Johnson, thank you for your insight this morning. We really appreciate it.